Well, good morning, everyone, and welcome to this, the final session in our Knowledge Exchange series celebrating Seniors Month, landing today on this, the final day of Seniors Month. We're delighted to have you with us today. My name is Don Wildfong. I'm the Implementation Facilitator with the Waterloo Wellington Older Adult Strategy. The Waterloo Wellington Older Adult Strategy was developed in 2018 and really represents a 10-year comprehensive plan to optimize the health and well-being of an aging population in Waterloo Wellington and to strengthen the system services and supports that they rely upon. We're delighted to be hosting today's session with the Elder Abuse Prevention Council. Today's session is being recorded and we ask that you interact with us today through the question and answer section. So we won't be able to see you and we won't be able to hear you. So the only opportunity we have is through the Q&A section. So I'm delighted to welcome our partners from the Elder Abuse Prevention Council. As you can see, there's a number of us here today, a number of people sharing their expertise and knowledge in this area. We have our guest facilitator today is Janine Murrell, and Janine will introduce the rest of our presenters, all of whom are members of the Elder Abuse Prevention Council, and she'll introduce them in just a moment. But first, let's talk about what we're hoping to achieve today. So our outcomes for this session are that you will learn about elder abuse and how it is defined. You'll learn about risk factors and signs of elder abuse and how to prevent and respond to elder abuse when you see it. And you'll certainly be introduced to some community resources and contacts for you or someone you know if they're in need of help. So without further ado, we'll transition straight to Janine Murrell. Janine is the Senior Support Team Consultant for Specialized Geriatric Services with Home and Community Care Support Services, Waterloo Wellington. Janine, over to you.
Thank you, Don, and thank you to the Waterloo Wellington Older Adult Strategy for graciously co-hosting this session with the Elder Abuse Prevention Council. Thank you too to everyone joining us today to discuss the complex issue of elder abuse. As Don introduced me as, my name is Janine Murrell. I am a registered nurse with Home and Community Care Support Services, Waterloo Wellington, as part of the Specialized Geriatric Services team. And I do work as the nurse consultant on the Waterloo Region Senior Support Team. And I will be your facilitator today. I'll be introducing my fellow presenters and our Q&A session. So here with me presenting today about elder abuse and about our Elder Abuse Prevention Council is Chloe Hamilton. She is the founder of Warm Embrace Elder Care Limited and the chair of our Elder Abuse Prevention Council. I also have with me Detective Constable Mike Payne, who is the elder abuse investigator for the senior support team with Waterloo Regional Police Service. With us as well is Samantha Kim, who is an MSW RSW and the Vulnerable Seniors Lead for Seniors at Risk in Guelph, Wellington with Canadian Mental Health Association. And partnered with her is Susan LeBlanc, also MSW RSW, and the mental health clinician for the Seniors at Risk team in Guelph, Wellington with CMHA. So to start us off, I'm going to hand things over to Chloe to start off the session with an introduction to elder abuse, as well as to the Elder Abuse Prevention Council. Over to you, Chloe.
Great, thanks, Janine. So I'm honored to be the current chair for the Elder Abuse Prevention Council here in Waterloo Region in Wellington County. So the very first question, well, first of all, who is the Elder Abuse Prevention Council? Because it certainly isn't just me or even just people here on the call today. We're a diverse group of volunteers who come from many different walks of life, and our passion is to prevent elder abuse. So our goal is to provide information in the community so everyone is empowered to support members of their community and prevent elder abuse, so that hopefully this is not a topic we're still discussing 20 or 30 years from now. So what exactly is elder abuse? Sorry, I'm missing a slide. What do we believe as the Elder Abuse Prevention Council? We believe that everyone in our community, regardless of age, gender, race, Everyone deserves to be treated fairly in all walks of life. And one of the ways that we can best support people in our community is through social connections. So it's important to maintain social connections and maintain an inclusive community. So what is elder abuse? According to the World Health Organization, there's a fairly long definition that it's an intentional act or failure to act by a caregiver or another person. But simply put, elder abuse is the mistreatment of an older adult by someone they should be able to trust or depend upon. So it's a situation where it's someone that you know or someone that you should be able to trust that has taken advantage of an older person. That's the gist of elder abuse. It can be broken down into many different categories. There are different types, including financial, physical, sexual, emotional, and neglect. And we'll give a quick overview of each. Financial abuse pertains to finances. It can include someone stealing money from a loved one. It could include using their property without permission, so using their home or selling their home or another asset. And power of attorney is very important, and I know that that will be discussed in more detail throughout the rest of the presentation. A key thing to keep an eye on is bank statements. You want to be sure that you're always looking at your bank statements, and if your bank statements don't line up with what you're expecting, that's cause for concern. There are many other warning signs of financial abuse as well. Keep an eye on all of those. Physical abuse is anything that causes harm to someone's body, discomfort or pain. It doesn't have to mean that it requires a hospital trip. It doesn't necessarily mean that there are major symptoms. If someone is uncomfortable physically, it qualifies as physical abuse. Warning signs, of course, physical symptoms on the body would qualify, but you also have to watch out if somebody's flinching or seeming uncomfortable around a particular person. That could be a warning sign that you'd want to delve into further. Under or over medication also qualifies as physical abuse. That's giving someone too much medication so that perhaps they might be kind of dopier or not fully alert, or failing to give someone medication such as pain medication so that someone is experiencing pain when their pain should be managed. A type of abuse that's very difficult to talk about is sexual abuse, but it does occur. Sexual abuse is any sexual contact of any type that does not include consent. It also includes people talking about sexual activity when someone does not wish to discuss that topic. Warning signs can include sexually transmitted disease or venereal disease that shows up without explanation, bruising, or even difficulty sitting or walking. And if somebody is really uncomfortable with sexual comments, or they're making inappropriate sexual comments when they didn't previously, that could also be a warning sign. Emotional abuse goes by many different titles. You may have heard it also called verbal abuse, mental abuse, or psychological abuse. It can be referred to as any of those. And that's when someone in a position of trust fails to meet someone's emotional needs. It could be failing to follow their wishes, removing their power-making decisions, so not listening to the decisions they wish to make. It's causing somebody emotional pain or anguish or distress. And it can include things like name-calling, intimidation, or threats. Threatening somebody saying, if you don't do what I would like, you're never going to see your grandkids again. That's emotional abuse. So what could be the warning signs of emotional abuse? If somebody suddenly has low self-esteem and they're tearful and crying regularly, if they're seeming particularly nervous, especially around particular people, or failing to make eye contact, and if they're starting to pull away from their social connections, groups that they previously attended, or in this day and age when we can't go out to groups, maybe failing to answer the phone or not being willing to talk to friends and loved ones the way that they used to. Neglect is when someone fails to provide the care that an elderly person requires. And that's a situation where that person of trust has a responsibility to provide care, but still they failed to provide what's necessary. It can be where they intentionally do not provide care, which is active neglect, or passive, where they don't realize the level of care that's required and they just don't have the skill set to provide that care. And warning signs could be denying access to service or leaving an older adult in a place where they're not safe. And a violation of rights is when it is failing to ignore someone's basic rights and freedoms. Just because we get older does not mean that we lose our rights. We have the same rights in our older age as that we've had all throughout our life. And we have the right to make our own decisions around health and personal care, providing we're competent to do so. And a violation of rights is when that's taken away. So warning signs could include when someone no longer has access to visitors, like friends and family, if their phone or computer access is being monitored or limited. And again, that social isolation is a key piece. Where can elder abuse occur? Sadly, it could be anywhere. It could be in someone's private home. It could be out and about in the community, a residential care setting like retirement homes or long-term care, or even in the hospital. It could be anywhere. And to whom does it occur? Again, anyone can be at risk. Elder abuse by definition is among older adults, but it can be anyone from any walk of life. And so we need to support the community as a whole, recognizing that anyone can be at risk. Elder abuse by default is complex because it's occurring in a relationship where there is trust. So unlike some crimes where it's by a complete stranger, elder abuse typically is by someone who is known and trusted. And so the emotions that come with it are highly alert and complex, that people feel shame, guilt, disappointment, a whole range of emotions. And that makes the response even more complex too.
Thank you, Chloe. And I do see we have had some more participants join us since we began introductions. So thank you to those who have joined. Please do ensure that you are putting any questions that you may have into the Q&A box as we go along. So Chloe kindly did go through the basic foundations of elder abuse, and a lot of that information can sound pretty disheartening at times. It is a heavy topic and it is a complex situation that we do deal with. There are lots of strategies though to prevent elder abuse and to respond to elder abuse. And so here with me now is Constable Mike Payne. He is the one of the two investigators on the senior support team for Waterloo Region with Waterloo Regional Police Services, and is one of my co-workers and partners who will help me now review prevention strategies.
Thank you, Janine, and thank you, Chloe, for setting the table for us as we deal with this and talk about this very challenging and difficult topic. What we try and do is, and we've been doing for many years now, is build capacity within the community and preventing the awareness. Elder abuse is preventable. The key to the prevention is a knowledge base. So when there's knowledge created, there's actions that can be taken. And some of the things that we see in our practice, as well as in the community when we educate or when we learn together, is certain steps that we can do to help our seniors to prevent situations of elder abuse occurring. So when it starts with a financial abuse or indicators of financial abuse, something that I've seen in the past and we continue to see is that lending of the bank card, the compromising or the providing of your PIN. And often the intentions are not, let's call it malicious in the beginning. The family member goes out and gets some food, some groceries. But when we have an opportunity and there's other mitigating factors in the relationship, once those bank cards are being used, those signs and usages become indicators of financial abuse, where we're seeing cash withdrawals, transfer of money to bank accounts. As we lead into prevention and your estate planning, and it's not your will that we really educate on, it's your power of attorney and who's going to help and assist with the management of your finances as you age and your abilities. You still have insight into what's to be done, but the complexities of your financial affairs, you would need someone to assist. Don't feel pressure if you think you can manage your own affairs, but if power of attorney can assist, create or have someone consult with a lawyer. We really advocate for an independent person assisting in setting up your power of attorney. Power of attorneys do not have to be family. They do not have to be lawyers. They do not have to be financial planners. And I'd go back to my point, they don't have to be family. And I'm very strong on this because if you have a family member who's not good at managing their own finances, has a history of bankruptcy or some collections issues, we can see the pattern of behavior that may come into place when they start managing the senior's financial affairs. I'll just take a few dollars to prevent the collections agencies, the collectors from coming towards my way, and we see money being siphoned or taken. You have a right in power of attorney documents to be informed of your financial affairs. That's part of the duties of a power of attorney for financial affairs. Property is what it's called under the Provincial Act in Ontario. We suggest strongly that you stay connected to your financial affairs, and that's staying connected to family. We advocate, and as a community, and the Elder Abuse Prevention Council is staying in touch with our seniors. That could be on a social media platform, that could be through Facebook and other social media avenues. Because we need to stay in control of our affairs. We have a right to make our decisions. We have a right to make good and bad decisions, and we advocate for making good decisions, but we all know in our families that everyone has a right to make their own decisions, good or bad. And that's the same for your health care, your living conditions, and your financial affairs. We've explained and we continue to advocate to know your rights, know when something's wrong, and what can you do to speak to someone moving forward. Who, I guess, as we talk about going on to the next slide and advocating for your rights and your wishes, which person do you want to make healthcare and financial decisions for you when you can't? And those are really hard and difficult decisions. I've looked within my own family, and they're very challenging. And speak to people that can give you some advice on that. What kind of medical treatments are you going to want at certain stages of your health or end of life type care in regards to personal care decisions? And you'll notice how I've moved from financial affairs property to personal care, which we call healthcare decisions. And that's another power of attorney document that can be created to help someone assist you make decisions when you can't. In fact, they would make them based on your prior wishes and advocate for your rights when you can't make your own decisions. You have to have these conversations, and they're very difficult conversations, but a plan. And all these plans can be fluid and these plans can change, but the person's rights and wishes need to be at some point communicated to family or in a document. In a perfect place, they're on a document, but we do know these are conversations that family have with each other. But have these conversations is the preventable piece and the actions that we want to see seniors take in speaking to their family about what will happen in these cases. Caregiving we see in our practice, in our profession as an intervention, or as we talk about harm reduction in our program. Being a caregiver for a senior as they age, we all have our own experiences. I came from a smaller community where my mom as a nurse and my aunt took care of our seniors, took care of my aunts, took care of my grandma. For my circumstances now, I'm in Waterloo. My mom and her, as she ages, she's in Peterborough. So there's significant challenges when I'm called upon to make caregiver decisions if I have to. And we know distance is the way it is in many cases of families. So how do you stay in contact with caregivers? What do you do as a caregiver? These are challenges that are before us and before me. We do know staying active for a senior is important. Be connected socially. We see groups of seniors working in community centers. It's been a real challenge for our community and our seniors over the COVID pandemic, as isolation is a huge issue. Social isolation is a problem. We see that. Look for respite programs when a caregiver needs help or a senior would just like to get out. Find your community programs that can help with alleviating the stressors of dealing with an aging parent, an aging family member, an aging friend. There's services, and we're almost a harm reduction intervention referral service program. Yes, we're the regional police working in partnership with Ontario Health and Home and Community Care Support Services, Waterloo, Wellington, but we want to intervene before we have to look at a more advanced case of a criminal investigation or a very, I guess, aggressive intervention in dealing with the situation of caregiver burnout. Our seniors have a right to make their own decisions. We want them to be treated with respect and dignity, and especially near end of life or as their health starts to deteriorate, they deserve the utmost respect and dignity to live in the best and most healthy manner possible. If you go to the next slide. What can we do as a community when it comes to prevention? Get involved in the Elder Abuse Council, your local council. Get involved in programs that will help reduce the isolation, become educated, become aware. I've been doing this for a while, but I'm always recruiting. I've reached out to colleagues who are joining the council. Find a local organization, either in Waterloo or Wellington, where you're making a difference. If it's the Alzheimer's Society, there's always a need for volunteer, and the volunteer need is ongoing as we come out of the pandemic and as life returns to normal, whatever that looks like as we get there. What do we do and how do we report abuse? And that's an ongoing challenge. We are direct advocates that the senior has the right to make their decision on the reporting of the abuse. If there's some flags and some symptoms that we're seeing, we need to talk to that senior, and it's not WRPS, the Waterloo Regional Police Senior Team. It doesn't have to be home and community care support services workers. It doesn't have to be the partners that are at the table here. It could be that family member, that friend, that neighbor saying, Mrs. Smith, I'm concerned about you. Is there something going on? And I can guarantee from our experience, those first disclosures aren't easy. You may get absolutely nothing. From my own personal family and our life, it was everything is just fine. Everything is just fine, when in fact it wasn't fine. We need to dig a little deeper. We need to be there maybe the next day, the day after. At some point, they may make a disclosure. Then we have to provide options that we're kind of giving you folks some resources later and during this presentation on what would they like done. It is victim directed. It is senior directed. Our seniors do not have their rights taken away from them because they turn 65. Our seniors have a right to live in risk. Our seniors have a right to make informed decisions. So it's very important that we know some resources when a senior makes a disclosure of some concerns. And that's where we talk about our local agencies and organizations to support our seniors. And we're going to give you some resources as we wrap up on where you could go. It could be the Elder Abuse Prevention Ontario. It could be the Senior Support Line. It could be the Elder Abuse Prevention Council, a website or information on resources on who to call. It could be the Waterloo Regional Police Service agencies where you would find resources on what to do. There may be a senior, and they're few and far between, that says, I want the police involved and I would like you to consult with the senior team. That is fantastic, and we would follow the direction of the senior on what they would like done. I have many files right now where they don't want family charged, but they want the family spoken to, and they have a right to have it investigated thoroughly and properly, where they can see what's happened to their finances, where they can see that, yes, in fact, my son, my granddaughter has taken money, but you know what? I don't want anything done. There are a few seniors who have said to me, I want you to speak to them. I want you to tell them this is elder abuse and what happened is wrong. And that's an empowering moment for a senior to be able to do that, and we would do that on their behalf. We do believe strongly in the restorative justice principles, where we would have family working together through possibly the Agency of Community Justice Initiatives to heal these situations, to possibly say sorry, or at the very least come to an understanding of where each other was in relationship to the abuse. Next slide, if we could.
Thank you, Mike. And I think that leads us nicely into how we can respond to elder abuse. And there are some pretty common guiding principles that we as teams that respond to elder abuse follow, as well as recommend to our community members to follow as well if you do sense that there's something going on with somebody that you know or somebody that you love in response to potential elder abuse. So where we always like to start off is talking to the older adult. So if it's safe to wait for a time when you're alone with them, when you're not likely to be interrupted, to ask caring questions about what might be going on and express your concerns, to make sure that you're not imposing answers on them and that you're listening to their experience. And as Mike said, asking what they want. It is important that we are following what the older adults would like to do if they are capable of making an informed decision. And as Mike mentioned, sometimes that includes laying charges against the abuser, and oftentimes it doesn't. Oftentimes it's a matter of wanting to make sure that they're safe and wanting the abuse to stop. A lot of times too, it's involved with wanting to get help for the abuser. So it's never as black and white as we think it might be. We have to make sure that we're respecting the rights and personal values of the older adult. And those rights include confidentiality and privacy and self-determination. As we mentioned, mentally capable adults have the right to make decisions for themselves, including choices that you or I might consider to be risky or maybe unwise or unsafe. We always recommend, if possible, to seek consent or permission. And in most cases, if you're able to get consent, that would include getting consent before sharing their personal stories, their financial information, or their health information with anyone else, even if you have their best interests at heart. Make sure to look for the least intrusive ways to offer help. If the person you're worried about doesn't want to take action at the time, it's important to respect their choice. But it's also important to keep those lines of communication open so that they know that you're there to help them if they change their mind or have some time to think about what they'd like to do. Of course, if the situation is dangerous, don't hesitate to call police or 911. Samantha and Susan will talk about community resources, but the police are there and should be called if we are in an emergency situation. Be sure to never confront or accuse the abusive person. They may take it out on the older adult. They may take it out on you. It's important to avoid ageism and not let ageist or discriminatory thinking affect your judgment. It's important to avoid stereotypes of older adults and to respect the dignity of all people, regardless of their age. And be informed. For anybody who works with older adults, it's important to make sure that you're educating yourselves about elder abuse. And as Chloe mentioned, to know that abuse and neglect can happen anywhere, by anyone, and to anyone. So learning the warning signs of abuse, learning what you can do to help, and what the law says that you must do when somebody's safety is at stake. If you're not sure what to do or you need support, it's important to check in with a professional. Thank you, Dawn. So safety planning. So often when somebody is being abused, they feel all alone in the world. That's a common feeling, I think, when we're looking at a situation like this. People may think that they're the only person who's being mistreated. And it's important to know that many people, unfortunately, are abused, and many people have found ways to deal with these situations. Some people choose to leave the situation, which is great. Others choose to remain and take steps to ensure that they're as safe as they can be, which is important to respect as well. Many times, we're talking about a victim who lives with or is dependent on their abuser, because we are talking about an abuser who is in a position of trust. So in that sense, it's important to make sure that we're supporting older adults to stay as safe as possible. So if possible, if something is happening, tell somebody you trust what's happening to you, whether that's a trusted family member, a friend, a personal support worker who might be helping you around the house, or doctor, a trusted neighbor, a service provider, anybody that you can trust. Tell them you do not have to be alone in this. Ask others for help if you need it. Be specific if you can about the type of help that you need. If somebody is hurting you or you don't feel safe, you can always turn to the police for assistance, and you should call 911 or call your local police service if you are feeling unsafe. Feel free to visit your local library, your community center, other information centers. If it's not safe due to the pandemic to go out, lots of information is online as well to find out what services are available for you to access. If it's safe to access the internet, to search for this type of information, keywords like abuse, elder abuse, violence, and safety are good keywords to search for. Right. Thank you. So some other thoughts in terms of planning a checklist if you need to. It's important to protect your personal documents and think about what you might do in case of an emergency. You may want to consider putting together an emergency kit. And so items to put in the kits may contain things like money, a change of clothes, important papers, an extra set of keys, perhaps emergency cash, medications, hearing aids, extra glasses, anything that you might need if you had to leave the house in a hurry. If you are living in an abusive relationship, our safety plan can help you live more safely day to day. It can also help you to plan a safer way to make changes or leave the situation. Leaving is typically the most dangerous time in an abusive relationship, so it's important to plan well and not tell the abusive person about your plan. There are lots of organizations and supports available to help you create a good safety plan, including a local shelter, your local senior support teams and seniors at risk teams, victim services, your social workers, etc. Next slide. So that is information for you about prevention and safety planning. I think, as you've heard, responding to elder abuse and supporting our seniors who are living at risk really is the responsibility of the entire community. There are lots of ways to prevent elder abuse. There are lots of ways to respond to elder abuse. And there are lots of organizations and supports available across Waterloo, Wellington. So Samantha and Susan are now going to review those supports with us. And again, since we have had some new participants, please do consider adding any questions into the Q&A box as we go along. There is no question too small or too silly to answer.
Thank you, Janine, Mike, and Chloe for going ahead and talking about, I think the common theme that we're finding is that it's a community response and that elder abuse is complex. So I just wanted to, show this graphic, which I think is a great demonstration that we are all a piece of this puzzle in supporting the older adult. It takes everyone in the community working together to respond and support older adults experiencing elder abuse, because we know elder abuse affects people of all backgrounds, ages, religions, culture, ethnic origins. I think some other additional considerations is that the elder abuse complexity is further noted when there's gender, culture, ethnic origin, age, class, sexuality experiences that affects an older adult. So each older adult is an individual and their experiences are unique to them. And there are many community support services with this understanding that can provide supports to older adults, such as Indigenous services, LGBTQ services, Francophone, religious services, or to name a few. These are important considerations in working together as a community as we support our older adults. And to always remember, older adults experience ageist stereotypes where they're depicted as frail, weak, and dependent, and this is not true. I wanted to talk about a program that we have that helps to build capacity in our community for members to recognize the signs that may indicate an older adult is vulnerable or may need assistance or services, and even some information about elder abuse. It is the Waterloo Wellington Neighbours Program, and we're hoping that it connects older adults to community supports. So this program is, again, as I had said, to increase awareness about the signs of socially isolated and vulnerable older adults. And again, with the principle that it is everyone's responsibility, and helping each other contributes to a better society. And right now we find that a lot more older adults in our community are more isolated than ever. And I think it's our responsibility as a community to learn about those signs and symptoms and to support each other. Some of the helpful community resources is here 24/7. It's your front door to addictions, mental health, and crisis services, and it's a service that's available across Waterloo and Wellington. It's an opportunity for people to reach out to speak to a crisis worker directly, and they can help you understand what you need and help to work to connect you, to get you connected to services. A wonderful thing about the service is that it is available 24 hours a day, 7 days a week. And this service can also help you connect with Seniors at Risk program or the senior support team. Another great service that's available is the Senior Safety Line. This line is also a 24-hour crisis and support line for seniors in Ontario who have experienced any type of abuse or neglect. It's open to any senior, and it addresses the diverse needs of those with disabilities, immigrants, persons of color, sexual orientation. They also provide information to relatives, friends, neighbors, and caregivers, and other service professionals who may have questions or concerns about an elderly person in their life. When you call this line, you will always reach a person to speak with, which is a wonderful thing. And this service is able to provide a counselor, and it also has referrals that can be done in over 200 different languages. So it's very inclusive. Another service that's available is through Victim Services, which Janine had talked about in her slides. This is a community-based nonprofit organization that provides support and service to victims of crime and tragic circumstances. I've included the numbers for Guelph, Wellington, and in Waterloo region. So we often see that there are services for women who have experienced abuse, and we know that older men are at the same risk of elder abuse. However, there are more supports in place for women. So older men also need the same support and advocacy, but these are options as well too. Other services available is the Home and Community Care Support Services and 211 Ontario. Calling 211 or looking online at 211, it's an opportunity where it provides information about the different community services and health-related and government services available in Ontario. It's an easy website to use if you have access to it. You type in what you're looking for and in the area, and it generates a list of different services that are available. In addition, too, there are many counseling agencies that are available in each region that can support older adults. And that's something to consider to look into. And I will pass it on to my colleague, Susan.
Hi there, everyone. Again, my name's Susan, and I wanted to talk a bit about family health teams. One thing to always consider is elder abuse can significantly impact your physical and your mental health. And talking to your family physician can be an important and often first step in taking to discuss your concerns about potential elder abuse. Family health teams are primary healthcare organizations that include a team of family physicians, nurse practitioners, registered nurses, social workers, dietitians, and other professionals who work together to provide primary health care for their community. And they ensure that people receive the care they need in their communities. Community health centers are very similar, and a lot of their services actually overlap. They provide primary health care, and they also provide health care promotion programs for individuals, families, and communities. So they can also assist with linking families with support and self-help groups that offer peer education, support with coping, and are working to address conditions that affect your health. Okay. This is the organization that Janine's probably touched on and works for, which is the Waterloo Region Senior Support Team. And they were previously called the Elder Abuse Response Team. It's a joint investigation unit between Home and Community Care Support Services in Waterloo, Wellington, and the Waterloo Regional Police Services, with a mandate to investigate and provide support to victims of elder abuse. The team consists of a registered nurse consultant and 2 investigators who will work together to provide information and consultation, direct intervention, and investigate matters of a criminal nature, provide education, training, and community development. So you can see it's quite a collaborative team. The focus is not purely just on investigating crime and laying charges, but it's to support that older adult in a holistic way. The next one is the organization that Sam and myself are involved with, which is the Wellington Seniors at Risk. You'll notice that with these two programs, they work out of the separate regions. For ours, we cover the Wellington area, and again, Janine and Mike cover the Waterloo region. Okay, the Seniors at Risk program is, oh, sorry, if you can go back, please. The Seniors at Risk program is part of, no, the next one, sorry. The Seniors at Risk program is part of specialized geriatric services at the Canadian Mental Health Association, and it consists of the Seniors at Risk clinician, myself, and the Vulnerable Seniors lead, which is Sam, and both of which we are social workers, and we have a knowledge in dementia and mental health. Seniors at Risk program works collaboratively with community agencies, including local and provincial police partners, to support vulnerable older adults living at risk or may be experiencing elder abuse, in addition to providing education and awareness to the community. And we're not just limited to the police services. Other agencies that we're frequently involved with can be fire, paramedics, hospitals, and doctors' offices, and really any agency working with older adults we frequently come in contact with. The last thing I wanted to address, and I think all of the speakers today have touched on this, is privacy and the client's right to refuse. And this is often the most powerful right that a senior has, is the right to say no. So here's we say the individual always maintains the right to refuse to accept services offered unless that individual has been deemed formally incapable by an authorized healthcare professional. But even then, when somebody says no, it's something that should be listened to, acknowledged, and respected regardless. And again, that privacy right to refuse may be, when we're getting involved, may be perceived to the individual as an invasion of privacy, interference with decisions not to seek help, and pressure to accept unwanted services. This, yes, that person may definitely benefit from the supports we'd like to offer, but right now may just not be the right time to be initiating those services. It's more important to have that person recognize that we are there to support, and when they're ready, we will still be available to help them. And again, the goal is to inform individuals of their options so that they can make an informed decision and what is best for them at that time. And again, isolation and resistance are best overcome by building trust. So again, with all of us, the members of this team, that is our goal, to develop that relation. Let them know, again, we are there to trust and support. We are not enforcing anything upon them. And of course, respecting choice, independence, and the dignity of that person. And whether those decisions are good or bad, it's their right to make that decision. And that at the end of the day, we have to respect that. Thank you.
Thank you, Susan and Sam. Chloe, I'm going to turn it back to you for some closing comments before we move on to any questions and answers that we might have.
Great, thank you. As was mentioned earlier by Janine, elder abuse really is a community responsibility. It's so important to remember that elder abuse is never the fault of the older adult who has experienced abuse. It is never their fault. Although people have complex emotions around it, it is never their fault, and it is important to remember that. And as a community, we wish to all rally around and support the seniors in our community to help recognize warning signs, respond when necessary, and support the older adults in our lives, so we can all take personal responsibility to be supportive of the people in our own lives. Important questions that you might ask somebody. If you are thinking there are warning signs, you're not too sure. Mike mentioned how important it is to speak to the older adult directly. And some of these starting questions are a good place for you to initiate that conversation. You can ask, do you feel safe? Is anyone in your life hurting you or making you feel uncomfortable? What do you want to do? And how can I help? Those are important questions to start your conversation. And there are 4 actions that you can take that make a difference and that help to prevent elder abuse. Number 1, remain connected with the older adults in your life. In normal times, that can mean visiting regularly. In this day and age, it might mean staying connected virtually, but call regularly, FaceTime, Zoom, whatever virtual visits you would like to do. But stay connected. Even just a quick check-in can make a big difference. Ask the tough questions when necessary. Don't shy away from the difficult conversations. And most importantly, listen. It's one thing to ask the questions and then rush along to a more pleasant topic, but it's important to give people the time and the space to actually convey difficult conversation material. Inform seniors of their rights. Sometimes people aren't aware of the rights that they do have. And so reminding people that yes, you have the right to make your own decisions. Yes, you have the right to manage your own finances. Yes, you have the right to say no, thank you. And then if you have any questions or concerns, or you think there are warning signs you'd like to know more about, call the senior safety line. And the 1-866 number is listed on your screen. Write that number down. It's an important number to keep tucked away. If you ever have questions or concerns regarding an older adult, you can always call that number and they can direct you appropriately. Thank you for attending our webinar today to learn more about elder abuse, the signs and symptoms, and then what we can do together as a community to wrap around our seniors and ensure that all older adults in our community can age with honor, dignity, and respect. Now I think it's time for questions. Thank you for having been active participants in today's webinar. I pass it back to you, Janine.
Thank you, Chloe, and thank you to all my fellow presenters and to Dawn. I don't see any questions yet in the Q&A, so please don't hesitate to add those in if you do have any. I will get the ball rolling with one question. This is our second National Seniors Month in the pandemic. Our second World Elder Abuse Awareness Day just passed on June 15th in the pandemic. And so although the province is opening back up with exception of Waterloo region, of course, as of today, we are still in this pandemic. And so wanted to throw it out to all of the presenters to ask what impact they've noticed that the pandemic has had in relation to elder abuse and seniors living at risk.
I can start, Janine, if you don't mind. Certainly in Waterloo Regional Police Service, as we work 24/7, we continue to see calls for service and our community continues to call us. As far as our senior team and how those calls are managed, I would say we've seen a heightened awareness in long-term care facilities with the media attention in regards to the issues in long-term care. We possibly, and there's lots to it, have known for a long time, they just seem to be more heightened and more aware due to the very aggressive media reporting of the issues and the tragedies that occurred in our long-term care homes. So based on our pandemic over the past year and a half, we've seen an increased calls for service. Those are diverted from our 911 system. We've got an in-house program where we're working with our partners in long-term care and in the retirement communities to directly report non-emergent cases to our attention for screening and reviewing. There is a mandatory reporting in Ontario for long-term care and retirement home situations that could be, and I'm saying could be, criminal in nature, and it's for our team to screen those to be criminal. I will say 2% of those are criminal in nature, but 98% are being reported to us, which is good. So there's eyes and ears and awareness being created. We will create prevention pieces in that when we give feedback to the homes on different strategies that possibly they could implement as they work as well with the Ministry of Health to deal with those situations of incidents, some abuse, some care type situations in those homes. So to shorten it up and to sum it up, we've seen an increase in calls for service in our long-term cares and our retirement communities.
I can speak to that as well too. I think in our area in Guelph, Wellington, and I'm sure in Waterloo region as well too, it's the community support services that are not available, that are not able to operate as usual, such as adult day programs that provided a lot of respite services and social stimulation for the older adult themselves, the respite for the caregiver. So people are more isolated and living in much more stressful times without having those typical outlets and opportunities to be active in their communities. We've also seen older adults who are not able to volunteer in their typical roles that they've always played an active role in their community. So that again is adding to the stress and isolation and increase in elder abuse and vulnerabilities in our area.
And I think just to add to that too is there's been a lot of direction and advice to older adults to remain isolated, to wear personal protective equipment, to not engage with the larger community because of the heightened risk for developing COVID. And they've done, many of them have done a very good job of that. But the negative impact has been their families have not been able to come visit, see how they're doing. Many people are declined having in-home support they may have previously had for housekeeping or personal care because of risk of exposure. So they're not seeing their family doctor the way they used to be. So no one's laying eyes on the individual to see how they're doing, see how they're managing, and people aren't as likely to pick up on the subtle changes in their health status. So we are seeing, I think, a lot more people that, again, it's that impact of social isolation and people just not being aware of what's going on that's increased the risk for many people. It's not necessarily an intentionally abusive situation, but again, that passive neglect has been quite common.
I would echo that. And Chloe, I think you had a comment as well.
Echoing what Susan's saying, that it's the social isolation piece that's so critical, and that's why staying connected with the seniors in your life is so important. And that's why I say even those 5 or 10-minute phone calls can make all the difference in the world, so someone knows you're paying attention, you care, you are there for them, maybe not physically in person, but you're there still emotionally supporting them. It reduces that sense of social isolation.
Thanks, Chloe. I don't see any other questions, and so I think maybe before handing it right back to Dawn to close us out, I'll just see if anybody has any final key messages that they wanted to leave our participants with. Any positive advice or notes, anything else to add?
I would say being here on this webinar today is a wonderful first step that shows that you're interested, and by informing yourself and learning more about warning signs of elder abuse, you are already making a difference in the community. So take that information back to your friends and your family, be willing to share that information, remind people of their rights, and keep an eye on the seniors in your community. Stay connected, and we appreciate all that you are doing to help prevent elder abuse in your community. Thank you for being a strong community member.
Thank you. Back to you, Dawn.
Okay, well, what a wonderful discussion and what a great way to wrap up our knowledge exchange series this month. You heard the presenters carefully talk about vulnerability and not labeling older adults as vulnerable, but perhaps speaking about them being exposed to conditions that would predispose their vulnerability. And it's how we can act as engaged members of society and our communities to recognize those conditions or those causes and utilize the strategies and tactics and tools that we've been presented with today and the resources, the many resources in our community. So I'm very encouraged to hear that there is so much support around prevention, protection, and enabling the empowerment of older adults in Waterloo, Wellington. So I thank our presenters very much, certainly to Janine for facilitating today's discussion, our presenters Chloe, Mike, Sam, and Susan. And I certainly, and probably most importantly, thank you for joining us today to become more informed about this topic. It's important for you to know that you'll receive following this session today a link to the recording of today's session. You'll receive the slides that were presented today and a survey evaluation, very short, a link to a survey to let us know how we did today. And we very much look forward to hearing your feedback on today's session as it helps us plan for future sessions. So as we move towards celebrating Canada Day tomorrow, a day that will be certainly rich with reflection as a nation this year, perhaps more so than others. I wish you well. I wish you good health and safety. And thank you very much to joining us. And thank you to our colleague, Giselle Loyola, who will be following up with the supplementary materials. Thank you very much. Stay safe and have a good day. Bye-bye.